Hi everyone, Dr. Timothy Gallagher.
And Dr. Michael Marciello.
And we're from Maragal Medical. This week we're going to be talking to you about all the different treatment options that you have for low back pain. If you're one of the millions of people out there suffering from low back pain, you're not going to want to miss the information we're going to share with you in a few minutes, so stay tuned. Okay, Dr. Mike, lower back pain. Some of the estimates show that 80% of the population is going to actually experience a lower back episode at least one time in their life. It's the second most common cause a patient will go to the emergency room. At Maragal Medical, we really have some great treatment options when it comes to managing lower back pain. Isn't that correct?
Very true, and you're right. I mean, so many people, all of us have experienced back pain in some way or another because there's many reasons for the pain to be there. The joints, the discs, the muscles, and then of course the sciatica nerve issues. But in the medical model, there's always this concept when we go through training that it's really not a big deal if you don't have a pinched nerve or sciatica, but that's not true. We need to make sure that we're looking at all that degenerative process, and we have the ability to do that here. We have the chiropractic component, we have the physical therapy component, and we have the medical aspects of getting all the diagnostic tests we need. Then we can plug them into really what the services we have, and there's so many things we can do.
Yeah, and as we talked about the videos before, and we just celebrated our 25th year anniversary as a chiropractic practice. You know, lower back pain is the most common condition a chiropractor is going to treat. And our expertise is in the field of spinal manipulation, or a gentle stretch into the joints to get those joints moving again. So most of the patients respond quite nicely to the more traditional adjusting techniques to get those joints loosened up. But on occasion, we'll get that patient that has maybe a disc injury in the lower back where the spinal adjusting may not be the best option. So one of the few clinics in the region that actually has spinal decompression tables. Those Cox decompression tables work really well. In our profession, it's the most highly researched technique out there. It provides the patient with a nice gentle stretch to the spine, where if they're suffering from low back pain due to a disc, it's going to be a little bit less invasive of a procedure, a little bit more comfortable. But then all the other lists of services, and that's why I just get so excited when we talk about, you know, our partnership and having the medical component, where you have Colleen on the physical therapy side. She gets to kind of really hone in on the patient's, you know, flexibility, the core strength and balance. And there's not a better way to focus in on core strength than with this fancy robotics that we have, the Hanova, but it's all the other services that we have as well.
Well, again, the idea is if it doesn't seem to like always go the right way, rather than having to finish the whole program, so many times people go to therapy and say, oh, that didn't work. Oh, they went to, you know, the other doctor, didn't work. Or they went to a chiropractor, they went to acupuncture. Here we can constantly reassess.
Yeah.
And it turns into more disc related. Well, I can get an MRI picture
Sure.
right away. We can actually look to see if it's the arthritic changes of the facet joints. The joints of the spine can get really problematic. And then we have a way to actually decompress those, as you mentioned, but then we can inject them. We can use muscle injections to kind of all that muscle spasm that kind of acts up. At the same time, I can provide, you know, a short course of medications to get that inflammatory process down, and then we work together. That's what makes it so unique here, that we can immediately pivot to get the next treatment, because it may not always fit into the same category. That just, oh, that's a disc, oh, that's a back problem, that, oh, that's nothing, that's just a back spasm. We really can put it together to make sure that we get injections in the right locations, again, the chiropractic adjustments, the right timing, the diagnostic tests at the right timing, and then really know that we're treating the right problem.
Yeah, and what I love about what you had just said, you know, back when you were at South Shore, you know, the standard protocol, you were writing a lot of prescriptions. You know, you yourself have said it, your prescription usage is dramatically decreased since we partnered, really emphasizing getting to the root cause of the patient's problem. But more importantly, the recommendations that you're making in the form of injection, they're more functional injections. Those trigger point injections, we use a natural substance, Serapin, that has no side effects. The regenerative medicine injections, the wart and jelly allograft that helps repair damage to the tissue, and then the PRP injections, again, you know, thinking outside the box, thinking for more of a solution where you're getting to the root cause and helping repair that damage. And that's what makes the clinic so unique.
Absolutely. Then we can get actually in there, get them stronger, and can take long-lasting benefits. So
Sure.
we're not looking just for short-term quick relief. You know, so many people are going to go to the doctor, feel better, okay, we'll see you later. Now we can actually start implementing the program to get them feeling better for the long term and hopefully prevent some of these recurrences from occurring over and over and over again.
Right? The bracing, the laser, all of these options, it just makes for a wonderful playbook when you're evaluating and treating that lower back pain patient. If you'd like more information about our practice, look us up on the web at maragalmedical.com. We've got a great library of YouTube videos, so if you have a chance, check out our YouTube channel. And folks, don't forget, we take most insurances. Well, that's it for today. I hope you learned something. We'll see you again soon.
Bye now.